diversity, holism, communication, advocacy. These are just a few of the core values you'll find in your RN to BSN handbook at WVUP. There are also some quotes and examples from the NLN, the National League of Nursing, on some of the values, such as caring, which is what I want to talk about today. Caring seems like the simplest concept. It's what we do as healthcare professionals. All nurses in any role, any healthcare setting, are providing care to their patients. Yes, I agree. It's an easy concept to understand in broad terms. However, caring means so much more to me, to patients, to you, than the general concept. What I mean by that is any word, any profession, anything can mean one thing to one person and something else to another. While caring, general concept is providing care, it also means way more than that to me as a nurse in my setting. In the emergency room, the care that I'm there to provide is emergency care. You come in as an emergency, I'm there to take care of that emergency. Stop the bleed, start the heart, give TPA for the stroke. I'm there to take care of an emergency situation. Yes, that is my job. However, there's so much more to my job in caring. Yes, I've got to do those emergency things, but I have to care. I can't just pass the med, do the vital sign, or hang the drip and leave. I have to care to listen to my patients, care to pay attention to them. They may be in there for stomach pain or head pain. They may be in there for something emergent or non-emergent. There's a reason they're there, and if I don't take the time, if I don't listen to their needs, if I don't care about what they're saying, and I'm just in a rush and I'm overwhelmed and I'm not listening, I'm not caring enough to give my patient time, I'm not doing my job properly. And I understand how hard that is to listen to their emotional, mental needs, to do all the extra things that a good, caring nurse does. COVID is rampant, the demand is high, the supply is low, we're overwhelmed and we're tired. I understand, but caring for my patient means giving them all I have, all that I can give them. I try to see each patient as a family member, to give the care I would give to my family member, my niece, my nephew, my aunt, my uncle, my mom, my dad. The care that I would want them to receive is the care I try to give to my patients. Also, there is a physical need. They're here with a gunshot wound. They're here with simple belly pain. They're here with a broken toe. Yes, they may be there for those specific problems, but there may be more to the story. If I don't care to listen to what they have to say, I might miss that big piece. Maybe the broken toe wasn't because she tripped on the steps and she's making nonverbal contact with me, trying to hint to me that the person in the room is hurting her. Or something as simple as a belly pain that you think is appendicitis, and you're going through the motions because you're just so used to something that you're not listening to the patient talk about other symptoms. You're not listening to the mom or the dad because we're just so tired and overwhelmed. We're not taking time to care properly for the patient. Caring for a patient means all of those things. It means all of the senses. It means mental, physical, every kind of problem possible has to be taken seriously. It has to be listened to. But also when caring for a patient, it means bed baths and it means feeding the patient. And I know, again, the supply and the demand are just not meeting in the middle, and it's so hard to do. But when you have patients who have come in, they've been laying in their feces or urine, they haven't been able to get up for days, or they need range of motion, or in many cases, my patients can't feed themselves and I don't have staff to feed them. So what do you do? What do you do? You have to make the decision. You have to make the time, and it's way easier said than done, and I totally understand that. You have to care enough to prioritize properly, take care of your patient as you would want to be cared for, as you'd want your mom, your aunt, your grandma, your friend, your cousin, your niece to be taken care of. Caring is so much more than just doing your job. You're not there to just get a paycheck. You're there to take care of the patient. And to me, it is one of, if not the most important part of any healthcare professional. If you're not taking care of your patient, you're not doing your job. So for those reasons and many others, I feel like caring is very underestimated and forgotten.